Well, welcome everyone, and thank you for joining us for this series. And thanks to Donald and the Pauling Library for co-hosting it. The lecture will be recorded and available after the presentation. The chat will be turned off during the presentation and everyone will be muted. So please hold your questions until the end. This is a series on Ayurveda's approach to common disorders, and it's being offered by Dr. Kaushik. Dr. Kaushik is one of the most experienced Ayurvedic physicians in North America with over 35 years in practice. He received his Ayurvedic training in India and his naturopathic degree from the University of Bridgeport. He also holds a master's in public health and a master's in public administration from the University of Alabama. He has taught and lectured on Ayurvedic medicine across the country and recently founded the Institute for the Advancement of Ayurvedic Sciences, which is a research and teaching institution. And it is under this umbrella that he is currently offering accredited courses in Ayurvedic health counseling. The next series will start in September. Dr. Kaushik is the owner of the Ayurvedic and Naturopathic Clinic in Cross River. We thank you, Dr. Kaushik, for offering this series.
Thank you, Ms. Young, and thank you, Don, for hosting me here, and then the library, Pauling Library, and all the individuals who come every month to listen. Our journey is to educate individuals to take care of themselves as much as they can. And there's always a situation where you are not able to take care of yourself. And that's where we come. So you can find me, you can find anybody else who is a qualified Ayurvedic doctor, Ayurvedic physician, or a practitioner, or a counselor. And basically the goal is to look for someone who had a training from someone who is also well experienced. So Ayurvedic field is growing so fast that I was just giving a lecture just a few minutes ago about the complementary medicine, and found that there's so much interest in Ayurveda. And during COVID, when we were struggling, as you know, and at that time, the topic is perfect allergy and asthma. Many were suffering from the ailments of the lung disease, and basically breathing was the biggest problem. So it is going into the nasal passageway and then getting causing inflammation in the lungs and the mucous membrane. And again, the topic is appropriate for that. So finding there's so much at that time, the Ayurvedic supplements like Amla or Giloy and Immunity Plex and the lung mix and Vasaplex, they were so effective and so useful. Basically, everybody who came and got help, and we were able to send them to people around the country, some outside the country. In fact, sometime the mailing cost will be more than the supplement, but again, it worked out. And reason for that basically is the potency and the time-tested combination of those herbs, which has been surviving for thousands of years. And now there is more awareness, and in naturopathy, we study Ayurvedic medicine. A lot of Chinese medicine have Ayurvedic herbs and a combination of those. So it has become very, very useful. So with that, I'd like to mention there is a Ayurvedic conference in Florida this year, October 27th to 29th, if anyone is interested. So there will be experts from all over the world, mostly from India, who have been practicing for 50, 60, 70 years, and all really old timers. And first mega conference in the US of that nature, first world conference, the international conference. So if anybody is interested, you can contact us, and we probably can give you a discount code or something. And also, when looking at the certification, I'm president of the National Certification and Credentialing Board of Ayurvedic Medicine. We always look for someone who actually been certified by the credentialing board, because we check their background, check their credential, the degree qualification. Since this is a growing field and open, there's no governing board at this point, and we are in the process of establishing that. There are many people who have no training. I read a book, or I worked with somebody, or I was listening or learning from a guru, and they became practitioner, whereas patients who come and they will tell me, I went to this person, didn't get any better. And then I tell them why, because there had to be a foundation. There has to be a proper education. And if that is not there, then basically it becomes an issue. So in that case, when we look at the allergies and asthma, so basically looking at the lung condition, asthma, just an overview, highest prevalence, 10 to 20% in their 20s. In children, boys are most likely to be affected. After puberty, girls are most likely to be affected. Can be caused by not eating enough fruits and vegetables. Genetic. Those with strong history of allergies have strong family history of asthma. Again, also there are many other factors. Basically, we're looking at the environmental factors. We're looking at the other living conditions. We're looking at allergens in their environment. So when you're looking at asthma and allergies, there are many factors. We cannot say that only one thing is going to affect. There had to be many, many more, which can be a part of it. Sometimes we find that everything is good, but the environment, which means the parents or somebody else in the family is involved in a business which is bringing chemicals at home, which are bringing glue at home, which could be bringing paints at home. So in that case, if they are stored in the garage and garage is attached, especially in the summer, all the fumes, which they generated because of heat comes in the house. And some of the old buildings, we're finding that the old pipes had old soldering, which has a lot of lead as they're becoming loose over the years that come in the water. So you look at every factor, and that is what we do in Ayurvedic and naturopathic combination. We look at the cause because, again, many times people do get some frustration. I see that. And their thing is, I've been going to doctor for almost 2 months. I did not see great results. I still have the problem. And I asked them, for how long you have the condition? 20 years, 22 years. So basically, people start expecting a magic when they have to pay from out of pocket, or when they are coming to a Ayurvedic doctor, because going to a regular physician is like a routine, keep going. And so the patience is important. Changing your diet is important. And so every time we talk about the diet and what you take, so all that, emotional status is important. All of those play a huge role in your healing process. Most common complaint of asthma are cough, dyspnea, wheezing, and chest pain. And again, it starts with the light cough, and again, it gets worse and worse and worse if it is not taken care of. But generally, when we are taking care of, we start using a inhaler or a pump or a supplement or medication, which we find most of the time over the counter. And when you're finding things over the counter, then the effect is not as good as it should be, because most of them are suppressant. They will suppress the symptom. Condition still exists. The cause still exist, and that has not been addressed. So we always go to someone who will take a complete history, also like to know or your living condition, finding out. I see many children who have those, and again, my address is to the parents. What do you do? And then it says he goes to school. No, I'm asking you, what do you do? So it is your lifestyle, is your home, which may be a cause how you are living, what is stored, how the house is built, when it was renovated, how old the house is, and also on top of that, the eating conditions, when you're cooking fresh or is ready-made, or there may be some preservative in your food, which could be a problem. So we look at all these aspects. And respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. It usually results from an allergic reaction or other forms of hypersensitivity. And it is an increased responsiveness of the tracheobronchial tree to a variety of stimuli. And those stimuli, like I said before, could be the chemical. And recently we saw that stimuli, it was not the chemical, it was not our fault. It's just the nature. The smoke came from across the border, and many people who had small irritation or have pre-existing asthmatic condition or lung disorder or lung condition, they were sick. Many people went to the hospital, many were inside, and thank God, after a few days, it went away. Just the nature played its beneficial role, air took it away. But again, many times my point is not us, it is circumstances. How we can control? We can't control the circumstances. The point here is we at any cost need to build and rebuild and make our immune system strong. We have to make our lungs clear and strong. We have to make our digestive system clear and strong. So many times we have factors existing within our environment, in our family, in our workplace. But again, the point we're trying to make here is many times we don't have a control, like in case of COVID, in case of these smoke came. So at that point, people who are already weak or already have weak lungs, those are the first one affected. So in that case, we need to make it stronger. And Ayurvedic medicine is the only system of medicine which talks about removing the cause and building the immune system. So basically, that's the reason every time we talk, doesn't matter if it's asthma, if it is for anything else, we always talk about the gut health because it starts from our gut. So there are two sources here. The most important thing in life is life itself. And what is required for life is oxygen, the prana vayu, the prana, the life force. And the only way we can take that in is through the lungs. So the lungs has to be clean, clear, and strong. If something is irritating your lungs, first you remove that irritant. If you smoke, somebody smoking in the house, or is there any chemical, and then try to see what kind of response lungs have. It means there is some irritants, there's some irritation. Why my lungs are weak? Try to build on those. Can cause shortness of breath and difficulty breathing, can trigger coughing, wheezing when you breathe out. So a lot of irritation. Types of asthma. Acute asthma is sudden attack caused by an inflammation of the air sacs of the lungs. Chronic asthma is characterized by frequent asthma attacks which require medical management to prevent and minimize attacks. And we have seen that, like I was giving an example just a couple of weeks ago. There were many who had just an inflammation in the lung just because of the smoke. They were having some difficulty in breathing, stayed inside, and basically were able to clear off. This is an acute attack. But when people have chronic, they are the one, because the lungs over the years, over the months have become so weak, they cannot handle any more contact with the irritant. And this was a very thick, strong smoke, and people had difficulty breathing. Exercise-induced asthma is triggered by exercise and is characterized by coughing, wheezing, or difficulty breathing. It is most common in children and young adults, occurring mostly while during exercising in cold and dry condition. And we see that in winter months when children are running outside in the snow, trying to make snowballs, throwing at each other. So even though they are playing, but it's an exercise. They are just basically, or I've seen many high school kids, just because of their requirement in their physical education, they are running, and we feel like, this is cold, and they are running in that cold, and especially when it's snowing, and that happens that time also. Allergic versus non-allergic, reactions, basically look at those, or asthma. Typical finding in both: hyper responsiveness of airway to stimuli, airway inflammation, especially basically looking at the eosinophils and lymphocytes, and you look at the airway remodeling. So in generally, when you're looking at the extrinsic and the basically, or extrinsic and intrinsic, look at, then basically you find a lot of commonalities. What is the difference between asthma and allergies? You look at the environmental factors, exposure to allergens during childhood, maternal cigarette smoking, viral respiratory tract infections, maternal vitamin D deficiency. Again, vitamin D for a long time was not basically understood, but now we know. And again, at that, going to older days, people were spending more time outside. And now we find mostly indoor individuals, especially children. And that is the gift of the technology to the children, because until there was no iPads, iPhones, all these games on this little machine, children were basically playing outside. And I remember those days when children come home and they just throw their bag and I'm going outside because everybody's outside. Now there is nobody outside. In fact, while they're walking from school or when they are picked up by the parent, they're sitting in their back seat and then they're playing on their phone. And that actually is something which need to be minimized or prohibited. We need to be basically, they should be playing outside. So there's no sunlight exposure. Children are not playing outside. Even the parents are not playing outside. They are on WhatsApp group, or they are sending messages, receiving messages, looking at some video. And so technology is great, but I'm finding that when it comes to the sickness, I see more people because of their lifestyle. And this is a lifestyle. And I often say one thing, when it is affecting your life, what kind of style is that? There's no style in something which is taking your life away. So style is when you're living healthy and do whatever it takes to have a healthy, balanced, normal life instead of being sick. Histamine constricts bronchial smooth muscles, augments vascular permeability and formation of airway edema, stimulation of irritant receptor. And then looking at the common stimuli, exposure to allergen, inhaled irritants, respiratory tract infection, and then in exercise, allergen exposure while you're exercising. The leukotrienes, some actions are similar to histamine, synthesized from arachidonic acid, involves lipoxygenase pathways. Also, some asthmatic have exacerbation of symptoms when taking aspirin or other NSAIDs. Several leukotrienes are powerful bronchoconstrictors. Inhaled irritants, number one is smoke. And if it is the second-hand smoke, is even worse. Inorganic dust, environmental pollutants, stimulate irritant receptors in walls of larynx, trachea, and large bronchi. Respiratory tract infections affects allergic and non-allergic asthmatics. Most commonly are viral. Again, one problem with the viral is once it goes inside and stays and becomes part of your mucous membrane, is hard to get rid of and keep getting worse and worse and worse. Mechanism is not clear, likely related to epithelial damage and airway inflammation. Exercise, frequent cause of bronchoconstriction. Key factor, heat movement from airway wall resulting in cooling of the airway. Inhalation of cold air during winter can exacerbate or worsen symptoms in some patients. So basically, Ayurveda recommends that the exercise is also in the months when the weather is not too hot or too cold. We do not recommend exercise in the extreme hot condition also, because when the condition is very hot, they're not supposed to be exercising at that time also. I mean, just the extreme heat. So extreme cold, extreme heat, both are not recommended, and you should be looking at the weather when you can do many hours, 2, 3, 4 hours of exercise. In the other months, minimal, which is basically done indoor. And indoor, the quality of air also is a big factor. If you have the cooling, heating inside the exercise place, Also, if there are filters or the air purifiers, and if you are basically exercising in part of the garage, and one side there's a car which you are warming up every morning and evening, and there's a lot of smoke and there are a lot of things stored, then you don't want to exercise there, because as you exercise, you breathe heavily, you breathe deeply, and in deep breathing, you inhale all these things which you should not be inhaling. So many things we look at which should be kept in mind. So Ayurveda for asthma and allergies, looking at the pranavaha srota. So it is the vikar, it is the abnormality or disease of pranavaha srota. Srota is the channel or the tube. Pranavaha, where the prana flows, the air flows, the oxygen flows. Asthma is caused due to kapha imbalance. And I'm sure you remember by this time, we have done so many of these lectures. So kapha is one type of body type or dosha. There are three main: vata, pitta, and kapha. Vata is a combination of space and air. Pitta is a combination of fire and water. And kapha is a combination of water and earth. So kapha is literally heavy, sluggish, slow, sticky, and also nourishing. Pitta is hot, penetrating, sharp, and so basically very sharpness of mind and the body. Vata is more air and space, so dispersing, thin, and in that case, that is what is the problem, is the condition of the Vata and the mixed in with the kapha, but their combination exists. So asthma is caused due to kapha imbalance, which means the phlegm is basically taking over, and in that case causing congestion, causing heaviness, and the gas exchange is not that effective or efficient, I should say. Pitta dosha will cause symptoms like wheezing, coughing, fever, and irritability. So in Pitta being hot, fever is always present. Vata dosha will cause wheezing, dry mouth, thirst, dry cough, dry skin, anxiety, and constipation. So these are all signs of dryness. So in Vata, which, like I said, is the combination of space and air, it causes dryness. And as we age, the kapha dosh, which is more heaviness, stickiness, more nourishing, is the childhood, 0 to 17. Then the pith is about irritability and heat, mostly, that is 17 to about 50, 55. Then the Vata dosh starts everything dry, and we start drying up. Wrinkles come and everything dries up slowly, slowly, slowly. And that's what we look at. Cells being covered in ama due to low Agni and Ojas. And that's one thing which causes the asthma and again, or allergies. So ama is toxin. Ama could be environmental toxins and could be occupational toxins, household things which we are using, or could be biological toxins. This causes a lack of cellular recognition and communication, increase in inflammation, and therapeutic goal: restore Agni and strengthen Ojas. Agni plays a big role. Agni is heat. Agni is the digestive fire. And Agni is the metabolic fire, metabolic energy. Agni is the energy of transformation. So when we eat anything or consume anything, it takes 3 to 5 days, depending upon our metabolism, to extract the food that we ate and nourish the body fluid. Body has 70% fluid. The extract of that fluid will nourish the blood. Extract of the blood will nourish the tissue. Extract of the tissue will nourish the fat. Fat will nourish the bone. Bone will nourish the bone marrow and nervous system. And finally, the genetic material and the essence of all of that will be Ojas. Ojas is the immune system. Ojas is the extract of the entire, all 7 dhatus. And that is the strength, that is the Oja, that is our ability to fight against any disease causing agents, anything which can cause any imbalance, we're able to fight. If ojas are strong, we don't get sick. If ojas deplete, we do get sick. So in this case, the therapeutic goal should be restore Agni and strengthen ojas. Agni, like I said, is the heat, your metabolism, your hormones, your enzyme. And so everything starts from the gut. And the strongest and the most important Agni is the Jatar Agni. Jatar Agni is Jatar means stomach. It is in the stomach. It is the Agni which is helping to absorb and digest our food. So Jatar Agni. Additionally, there is an imbalance of Vata. Of course, Vata is the what's moving it. Visham Agni, irregular metabolism can cause aggravated Vata, where Agni goes through a drastic change, causing many abnormalities. So if we are able to manage our Agni, I think most of the diseases can be controlled. Allergy is a result of the following: weak Agni. So anybody who have allergy or asthma, we always ask question about how is your digestion, how is your bowel movement, do you have any constipation, or do you have any diarrhea, or do you have, or what kind of bowel movement you have. So we have a detailed poop talk. Many children don't like to talk about that, but again, we need to be looking at what you're eating and what you're excreting. So input and output need to be discussed. We need to see what is going on in this body and what is coming out, and how your body is processing it. And in that journey, when Agni is weak, when the digestive fire is weak, but is not absorbing everything properly, and it sits there for longer, Ama is accumulated, toxins are formed. Just imagine this is fermenting inside, and it produces toxic gases, and again, Ama is accumulating inside the gut. Individuals' basic body constitution, imbalanced doshas in the body, Vat, Pitta, Kapha, that is also plays a big role. Also, we're looking at the conditions of the dhatu, which is the tissue, Agni, how the Agni is. So that need to be kept in mind. Also, this all determines which tissue or organ system will be affected. So when you're looking at the dhatus, depending upon where the Agni is not doing its job, it could be the body fluid, could be the blood, could be the tissue, the fat, bone marrow, nervous system, and could be the last one. But again, in generally, these are the 6 dhatus affected, and deeper we go, more complex the issue will be. And each dhatu have its related organs. For example, if something is only in the rasa, which is the body fluid, then you're superficial. You will see skin conditions like acne and psoriasis and things like that. But when it goes a little deeper, then you see the conditions of the blood, the condition of the tissue. So keep going deeper. So in that case, depending upon condition of the dhatu and Agni, that will determine which tissue or organ system will be affected. Weak immune system, and also amount of allergens in the body. So it's what causes the allergy, and this is what we need to be looking at. Vata relates to allergies, which cause sites for Vata, including the nervous system, respiratory system, bones, and colon. So there are individuals, when they have any kind of allergies, they are depressed or anxious. They go mostly anxiety, have difficulty in breathing, shallow breathing or very fast breathing, and cracking of the bones. And also the colon is dry, where either most of the time they have the constipation. Bloating of stomach, flatulence, burping, abdominal pain and discomfort, nerve pain, tingling sensation in limbs and twitching of muscles, loss of sleep, bone aches and pains in joints and intestinal colic, sudden with wheezing or sudden wheezing, dizziness, tinnitus or earaches, also prone to constipation, anxiety, restlessness. And again, in most of the Vata is the constipation, dryness inside. And like I said, they become restless. Pitta, site of Pitta dosha are skin, eyes, parts of the digestive system, liver and spleen, red rashes, urticaria, allergic dermatitis, eczema, redness of the skin with itching and pustule formation. Individuals may have heartburn, nausea, acidity, diarrhea, burning and redness of the eye. Cough related, the site is sinuses, nasal passages, parts of the respiratory system, runny nose, mucus accumulation, hay fever, congestive disorder, cold, cough, or sinusitis. Individuals may also have water retention because it's kapha, holding, heaviness in abdomen, sleeping disorder, difficulty in sleeping. And so when looking at in Ayurveda, we like to detoxify the ama, because if there are blockage, that is what need to be removed, the ama, and strengthen the nerve, strengthen the lungs. So in case of lungs, Udana Vayu that controls adequate respiration originates from amasya or the gut. What weakens lungs? Smoking, toxins, or chemicals used, stress, big factor in modern society. Cold food, that's also a big factor, because most of the sandwiches and all the things we take, and if they are preserved, then they have nutrient deficiencies also. So in that case, we need to be looking at what we are eating, what we are consuming, and again, make sure there's no smoke in your area, in your neighborhood. So looking at the liver, which is also play a role in case of detoxification, and which makes the lungs healthy, which also to remove the allergens, vital player in maintaining digestion and metabolism. It has phase 1 and phase 2 process. The roles include detoxification, bile formation and excretion, digestion and metabolism, protein metabolism and synthesis, hormone creation and metabolism and storage of fat. So even though it is about the allergies and asthma, like I said before, we do bring in digestive system. Again, liver, kidney play a big role because these are the organs of detoxification. And since we know the cause of the asthma bronchitis to some extent, asthma or asthma or allergies is toxins, in that case, toxin removal is very important. And that's where we look at the liver and we look at the digestion and we look at the kidneys, because we need to take care of them. And Ayurveda links the liver with Agni and Pitta dosh. We mentioned that before. Movement of Vata also plays a role. And again, we're looking at the sign and symptom of liver imbalance. Again, these are basically, fatigue, nausea, vomiting, edema, itchy skin. And mainly we're looking at the abdominal pain or swelling, because if there is compromise in our absorption, that becomes a big part. Like I said before, we do talk about kidney because it is basically taking care of all the toxins. And so if the toxins are there, then basically this body is going to be weak. Body is going to be full of toxins. And in that case, we need to be keeping in mind that anytime we have either any condition, we always pay attention to the health of the kidney, we pay attention to the health of the liver, we pay attention to the digestive system. Lymph becomes a very important part because is the immune system. Agni governs the transformation, governs digestion, absorption, assimilation, and transformation of food into energy. Like I said before, whatever we eat, it is the Agni which transforms our food into or extract of that nourishes the body fluid, fluid to blood, blood to tissue, tissue to fat, fat to bone, bone to bone marrow, and eventually nervous system, and then genetic material, and then ojas. So we always bring that in because having a strong immune system, having a, again, most of people who have asthma attacks and weak lung also have weak immune system. Just remember, lungs are the only place where pranavayu is absorbed. This is the place where oxygen is absorbed. This is the where gas exchange takes place, and we release carbon dioxide and absorb and bring in more oxygen. If that part is filled with phlegm or kapha, then how would we have a better gas exchange? How would we absorb more oxygen? So in that case, body will be fighting for oxygen, and that is extremely important. So in that case, you want to make sure our immune system is intact. Gut microbes always play a role, and we always bring that in, that diet can have profound influence on the detoxification. GI tracts also help in that. So in that case, we look at the gut health, the brain circulation, and the gut-brain communication is important. The dhatus we already talked about, the fluid, blood, tissue, fat, bone, bone marrow, and then nervous system goes with that, and then the sperm or the eggs, and ojas is the pure essence. Our ultimate goal is to enhance and make the pure essence, the ojas, so we're able to fight, we're able to resist this disease. And in the modern time, our lungs are so weak because of shallow breathing, because of the toxic fumes, because of chemicals being used inside the house. So people just to spray, just to make the house clean, we spray a chemical, basically a little mist to make it fresh smelling. We need to open the windows and the door, get some fresh air, or have a, if it's winter, then we want to use a air purifier, and the technology to some extent can be used if it is something, if it's not causing any harmful effect. So in that case, that is very, very important. So we understand dhatus. Again, we mentioned that so many times. Tejas include Agni, and light is the primary energy involved in direction and again in transformation of everything we eat, drink, do, think, and feel. Tejas is the energy expressing biological intelligence. Also, ojas is a subtle substance expressing vital protective energy, and prana is the life force. Again, life force is what we are talking about, the prana, which is coming through the lungs, and we have to make sure that the lungs are clear, lungs are clean, so that we make sure we have a better gas exchange. So ojas also include the endocrine, nervous, skeleton, muscular, hepatopoietic, and digestive system. When all these systems perform at the optimal level, ojas are maintained. Therefore, ojas is the potential source of strength, power, and resistance. So you mentioned these before also. So basically, this looks like a repetition. And in that case, when we're looking at the slides, some slide in Ayurveda, which will be in our lectures, we keep repeating. And reason for that every time we need to pay attention on the stress, need to pay attention on the ojas, need to pay attention on the importance of a good digestive system. Also need to pay attention on the excretion, which means detoxification. And sleep plays a huge role. So we want to make sure that we basically pay attention. So generally in the lifestyle, the air filters in bedrooms and most used areas of the home are very important. Allergen-proof covers on mattress, box spring, and pillows is important. Hypoallergenic or 100% cotton bedding is important. Avoid carpet in home, so because they become the breeding ground of bacteria. So if possible, you have wood floors. If not possible to have wood floors, those basically coverings, plastic coverings, there is just basically even concrete is better than the carpet. You have area rugs, great, they can be removed, but again the carpet stays there for many years. Something spill, we can clean. On top of that, we spray to remove the odor. Now we have more chemicals in the carpet. Use leather and wood furniture. Vacuum regularly, vacuum with built-in HEPA filter, which is the best. Avoid pets in the bedroom. Again, pets are lovely, but again, they should not be allowed in the bedrooms or in the bed. They should have their separate area where their bed can be cleaned. They usually come with a cover. You take the cover off every week and wash that, because they are also part of the family. And if they get some kind of allergies, then they spread it. Avoid harsh, toxic cleaning product. Again, cleaning product should always be organic, made of plant-based resources. Avoid outdoor air when pollens count are high. So stay inside if possible. Again, during COVID, we have now learned and mastered how to wear mask. Before that, it was rare to see anybody with a mask. And so we found that the mask can prevent to some extent. So a good N95 or any of the good mask, when the pollen count is high, again, that comes into play, and wear that. Exercise, which is decreases asthma. Eat, sleep, and wake up at the same time, so you have regularity and some discipline, so your body knows when to expect rest and when to get up. Eat only when hungry. Reduce creation of excessive asthma. Deep breathing is important. Calm the autonomic nervous system. Avoidance of pesticide and other environmental toxins. And I've seen many people spraying a lot of chemicals outside, and just to make the lawn green or get rid of things. But again, don't just spray things just because you like to. If there is a need, basically use that. But and if you can find something less toxic, use that. Heavy metal detoxification would be beneficial. And I'm finding that more and more affecting the health of individual and people who have not only chronic disease like asthma or bronchitis or diabetes or hypertension or high cholesterol. I'm looking at the serious conditions like cancer. So basically looking at the heavy metals, but to more specific, the 4 neurotoxins which go the deepest, the lead, the mercury, arsenic, and cadmium are the one which we need to be focused on. Again, if we have any clue that we may be involved in a work or business where these are probably present, a good thing is do whatever possibly it takes to remove those or stay away from those sources or cover them or keep them in a container where they will not be exposing everybody else. And definitely no smoking. The Vihar, setting a routine every day. Breathing, deep breathing is important. It opens up the alveolar sac, lung, and as the alveolar wall is becoming thin, gas exchange is better. That is what deep breathing does. Relaxation methods. Spend time with friends and family. Talk with your pet. Very important. Take a walk. Journaling is important, and practice gratitude, which is, we mentioned that over and over. Some of these topics, some of these points you have seen before, but it doesn't matter what, they always play an important role in our healing process. So we have to have a routine. Deep breaths, deep breathing is always important, and relaxation is always important. These are some of the methods. So spending time with family and friends, talk with your pet, take a walk, journaling, and practice gratitude, which is the most important. Adequate vegetables intake, leafy green vegetables, avoid cold food, avoid red meat, chicken, turkey, fish, okay. No processed foods and minimal sugar is important. Omega-3 is always important. We always mention that flaxseed oil and flaxseed powder are important. Fiber is important. Avoidance of any food allergies and intolerances. So we're looking at common intolerances of the food, basically if it's coming from the fish or the meat or coming from the wheat or coming from the rice or coming from, there's so many, sometimes dairy, sometimes, there could be specific allergen which be causing that. And again, anti-inflammatory spices and foods, ginger, turmeric, garlic, clove, fenugreek, all these basically are looking at saffron, anti-inflammatory. Be sure to monitor what foods help you have a healthy bowel movement every day. So you watch what you eat, and when you're watching the input, that will also affect the output, what is coming out. If you're eating certain food, that causing constipation, and it makes you sit there on the commode for a day or for hours and hours. There is something stuck inside. There had to be something dry, which is basically not moving as regularly, as smoothly as it should. So based on the food you eat, then you realize what effects is having on your diet, but in your food, in your process, in your health, in your metabolism, in your digestion, and based on that, you can change. In cooking, ginger, black pepper, turmeric, garlic, ajma seed, ajwain seed, black cumin seed, saffron, flaxseed, honey, but not warm, because when we warm or cook the honey, it becomes toxic. Saffron is very beneficial, rich in carotenoids, anti-inflammatory, antimicrobial, anti-nociceptive, excellent for heart health. And we're looking at the Oshadi, we're looking at Dugdiga, Boswellia, quercetin, NAC, glutathione, carotins, omega-3s, bromelain, vitamin D, copper. Vasaplex is a combination, and Immunitiplex is also a combination. Vasaplex and Immunitiplex both come in liquid, but Immunitiplex come as the capsules also. And so basically, again, like I said, during COVID or any allergy condition, we have used the combination, 1 tablespoon of Vasaplex, 1 tablespoon of Immunitiplex combined, and we also use something called lung mix. It has combination of many herbs. Instead of giving 4 or 5, we combine into 1, and we ask the patient to mix that with ginger juice, which is a carrier, and honey, which is also a carrier, so that takes it faster to the lungs. And if somebody is diabetic, we tell them not to mix the honey, then use only ginger juice to make a paste, and keep them in a ball, and then take 1 teaspoon of the paste 3 to 5 times a day, and people see relief very fast. Immunity boosters, Immunitiplex, liquid Immunitiplex capsule, vitamin C, zinc, vitamin A, giloy, amla is also immunity booster. We also give a lot of Chyawanprash. So Chyawanprash is a jam, very good for boosting immune system. Supplement, magnesium citrate, it relaxes bronchial smooth muscles, 300 to 600 milligram per day. Vitamin C, important for making epinephrine, used in vasodilation. Antihistamine, 500 to 2000 milligram per day. Sometimes we give it more, up to 6 gram. Vitamin B6, after histamine metabolism, it will alter the histamine metabolism. Give with magnesium, 50 to 200 milligram per day. Vitamin A improves epithelial and mucous membrane health. Vitamin E can neutralize damaging effect of ozone, which is in the environment. Zinc boosts immunity. Selenium activates glutathione. So basically, when you're looking at the condition based on other underlying condition, this changes. But if somebody already have a lung condition, they must carry a rescue inhaler with them while they have issue with the lungs and when the lungs are healing. In treatments, we do Abhyanga, Ayurvedic rejuvenating massage with different herbal oils combined. And Abhyanga is important because this is the way we are providing herbs and supplements through the skin. And since skin is the largest organ, it can absorb more supplements than what you can give through mouth. Shirodhara, calming the mind. Svedana is basically steam, and we use ozone. As the steam open the pore, more ozone goes inside. Basti, important to expel amas from the gut. So it is a decoction of herbal oil, and it goes to the anus, to the rectum. And basically, if it dissolves, this is a more oil, fat, it dissolves all the toxins and take them out. Incorporating self-abhyanga and oils into your daily routine. Grounding yoga practice, focus on breathing and pranayam. Balancing Vata through the Muladhara chakra. Incorporating breath work and meditation. And why it is vital for strengthening the lungs. So it's very, very important to do that. Okay. So basically, we look at the one thing I always mention: Samadosh, Samaganishta, Samadhatu, Malkriya, Prasanna Atma, Indriya, Mana, Swasti, Itya, Vidhyate. Basically, all the doshas, Vat, Pit, Kaph should be in balance. All the Agni is in balance. all the 7 dhatus in balance, and excretion in balance. The Atma, the soul, is happy inside. All the 5 sensory organs are in balance. And that is what we call a healthy individual, which is not easy. So creating balance is what we are looking for. And with that, I would like to thank you. We do offer a course in Ayurvedic medicine, counselor level course and practitioner level course. We are accepting applications. So if you're interested, do reach out to Ms. Young, or you call the office. The number is there, 914-875-9088. And anybody who wants to join us later on as a part of the training to the journey to India for helping the needy ones, you'll be a part of that journey. Again, thank you very much. Back to you.
Dr. Kaushik. Dr. Kaushik returns on Tuesday, August 8th from 7 to 8 p.m. for Ayurveda's Approach to Common Disorders, Lyme Disease. So if you would like to sign up for that presentation, please do email me, Donald, at adult@paulinglibrary.org. I'm just going to ask our participants to unmute themselves. If anyone would like to ask the doctor a question, now is the time. Thank you so much.
Looks like no question. Again, thank you.
Okay. All right. I guess no questions. So thank you, everyone. And we look forward to seeing you next month. Thank you. Thank you, Dr. Kaushik.
Thank you, Dr. Kaushik.
Yes, thank you.
Okay. Goodbye now.
Thank you, Dr. Kaushik.
Thank you. Thank you.
Incredible lecture. Thank you so much. Very helpful.
Thank you.
Thank you.